Good afternoon, everyone. Thank you for sticking around to the end. We saved the best for last here, so you'll be well rewarded. My name's Herbert Band. I'm a fellow in the Stanford Distinguished Careers Institute. And on behalf of my co-moderator, Kari Nadeau, we wanted to thank the organizers for including NCDs and planetary health in this wonderful conference. I'd like to introduce the topic with 3 points. What the heck are NCDs and why should you care about them? Secondly, what are we doing about NCDs at Stanford? And third, my ask of this group. NCDs, non-communicable disease, chronic conditions. The first point I'd like to make is don't get hung up on the name. None of the panelists here invented the term NCDs, and none of them has the ability or the authority to change it to something better. So when you think about NCDs, think about 5 by 5. 5 major diseases that I think we can all relate to: cardiovascular disease, cancer, diabetes, chronic respiratory illnesses, and mental disorders. Those are the big 5 NCDs. And think about 5 common risk factors: unhealthy diets, lack of exercise, physical inactivity, smoking, excessive alcohol consumption, and importantly, air pollution. So 5 big diseases, 5 big risk factors, 5 by 5. These diseases have a massive impact on human and planetary health. The global mortality from NCDs is 40 million people a year. So a population the size of California dies each year from NCDs. Predominantly in lower and middle income countries, over 80%. So these are not rich world diseases as people used to think of them. NCDs will be the leading cause of global disability by 2030, and the economic impact is huge. One study estimated a cumulative economic impact of $47 trillion by 2030. And even by US deficit standards, $47 trillion is a big number. There is an SDG target on NCDs to reduce premature NCD mortality 30% by 2030, but nobody in the NCD community is satisfied with the progress that has been made so far. In fact, as we heard about the other day, only 2 to 3% of global health resources go to NCDs. So 70% global mortality, 2 to 3% of resources. This is a huge disconnect. And recently, the Lancet called to radically rethink NCDs and really treat them as a global health emergency. What are we doing at Stanford? We started a new initiative with support from Michelle Barry, Kathy Burke, Kari Nadeau, and others called the Global NCD Innovation Initiative. We're really trying to do 3 things. One is create a sense of urgency around NCDs. Secondly, accelerate the development of innovative approaches to addressing NCD prevention, diagnosis, treatment, and control using data and new technologies and new thinking, and championing inclusive partnerships as a key part of the solution. If you want more information about the Stanford NCD-I initiative, please contact me, hroband@stanford.edu. So that gets to the ask for today. You're all here because you care about human and planetary health. Please consider advocating for NCDs as part of that, and we will try to make the case today about why that makes sense and the fact that there are co-beneficial solutions between planetary health and NCD prevention, treatment, and control. So with that, let me introduce someone who works at the intersection of human and planetary health every day and does it very well, Dr. Kari Nadeau.
I feel very fortunate today, and of course, most importantly, to have time for our panel. And we appreciate all of you to come here, and we'll have time for questions, and we'll make sure that we keep on time. And thank you again for staying here. So just briefly, when we talk about NCDs, we also have the opportunity for prevention on communicable diseases as well as non-communicable diseases. But importantly is when we talk about the planet and its health, it has a direct reflection on how we can take care of ourselves individually as well as on public health, both for our children, for the unborn children to come, as well as for future generations. So I'd really love to make sure that for each of you to think about when you're hearing our panelists speak, what are the opportunities for prevention? What are we going to learn from that? And then take that in terms of how can we improve our planet. I can just tell you examples as a physician, as a pediatrician, and an adult trained doctor is that many people are asking, well, what should I eating? What type of microbiota should I be taking so that I can decrease the risk of allergies and asthma, decrease the risk of diabetes, or decrease the risk of a heart attack? So many things that we have done to construct medications could have been done better if we had learned how to prevent those diseases in the first place. So I'm really excited about talking about NCDs today, as well as talking about plans for prevention. Thank you.
Thank you, Karen. So we have a wonderful panel up here to discuss this topic. I really want to thank them for being here. I'm going to keep the introductions very brief, but would encourage you to look in the program for their full biographies, because they're all extremely accomplished professionals in their field who've really been at the forefront of this discussion. And I think you'll see that when you hear from them directly. So let me start by introducing Howie Frumkin, who's here. He's the head of the Our Planet, Our Health initiative at the Wellcome Trust. Please welcome him to the podium.
Well, thank you very much, Herb. Thanks to the Planetary Health Alliance team, who's done such a wonderful job. Thanks to the Stanford team, who's done such a wonderful job. And a salute to all of you who are here almost at 5 o'clock on Friday afternoon, the last day of the week, the last day of the conference. It's a beautiful afternoon outside. You are living, breathing, throbbing proof that sustainability exists. Well, we as a panel have resolved to cover a lot of the issues at the interface of planetary change and non-communicable disease. My assignment is to address the issues that are shown here: urbanization, air pollution, energy, and the built environment. It's a very small assignment. I have 6 minutes and 52 seconds left to do it all. And the pictures that I've put on this slide are designed to remind us of the breadth of these issues and their centrality in the way we live our lives. Urbanization, the typical, prototypical form of human habitat these days. Air quality coming both from stationary sources, you see a picture of a power plant there, and from so-called mobile sources, motor vehicles. The many ways in which we use energy, the many ways in which we travel, and the buildings in which we live, work, study, play, and pray. So there are far-reaching parts of our lives. And the first thing I want to say is that the intersection of all of these upstream drivers of global environmental change, as they interface with non-communicable disease, is a very important interface. The first piece of it to mention by way of context is just to echo Herb's comment that an enormous proportion of suffering and dying globally is attributable to non-communicable diseases. This area matters. The second contextual point is that many of the drivers of global environmental change are highly relevant to non-communicable disease. One way to make that point is to look at a picture like this, showing in a simple pie chart the origins of greenhouse gases. And what you can see is that the energy we use, which has a great deal to do, as I'll mention in just a minute, with non-communicable disease, the ways we travel, the places we build account together for a large proportion of greenhouse gas emissions. I haven't highlighted the bottom right, the orange slice of the pie, which is the food system, which Bill and Modi will address in just a few minutes. But this array of causal factors has a lot to do with non-communicable disease. And not surprisingly, the third contextual point to make is that the solution space for both non-communicable diseases and global environmental change has a lot of overlap. So this is one of many lists. Maybe you're familiar with Drawdown. This is a list I happen to like, 10 ways to save the world. And as you can see, 2 of them, transitioning to renewable energy and building greener cities, are directly germane to the NCD causal pathways that I'll be discussing. I haven't put a star at the bottom, transitioning toward a healthier diet, but you'll hear about that in just a minute. So this interface that Herb and Kari have highlighted for this session is, in fact, a very, very rich interface, giving us lots of opportunity. Well, I'm going to describe some of the pathways through which global environmental changes affect non-communicable disease risk, and I'm going to simplify greatly in the 4 minutes that I have left. Just 2 main families of pathways. One is fossil fuel combustion. And what you see here is that we burn fossil fuels in the transportation sector, in making electricity, and in industry, as well as in other places. Those in turn give rise to two twin and related problems, air pollution and climate change, and those in turn lead to the risk of non-communicable diseases in many ways. And you're familiar with these. Air pollution resulting from fossil fuel emission is an important trigger of cardiorespiratory disease, accounting for millions of deaths annually. Climate change affects NCD risk through a number of pathways, some very obvious, some not so obvious. So, for example, climate change increases the formation of ozone in urban areas. Ozone is a respiratory irritant. Climate change increases the risk of wildfires, and as we just heard, wildfires target those with cardiorespiratory disease. But there are less obvious pathways as well. So, for example, as climate change compromises the production of some foods, and as those foods then become more expensive through market signals, people who are food insecure do what people who are food insecure do when food prices rise. They shift in their food purchasing habits toward calorie-dense, nutrient-poor foods, aggravating the risks of obesity and all of the conditions that go with obesity. So lots of pathways through which climate change raises NCD risk. The second family of causal pathways relates to bad urbanization, and I've shown a few elements of bad urbanization here. Urban sprawl, the geographic expansion of cities over big areas as opposed to compactness, the loss of mixed land use in the urban fabric so that residential is separated from commercial or recreational, requiring great trip distances, which can't be served efficiently by transit, leading to automobile dependence, as you see there. And then coming down to the smaller spatial scale of bad buildings, by which I mean both energy inefficient, using toxic materials, and unhealthy for people. Well, those contribute, as you will have appreciated from what I just said, to air pollution, to climate change, to social isolation, a plague in modern cities around the world, to sedentary lifestyles, and those in turn contribute to non-communicable diseases. So just a couple of closing points about the potential of the planetary health format to enrich our dialogue and our insights about non-communicable diseases. Much of the NCD discourse globally has had blinders on. I just picked two graphics at random to show, but if you look for graphics about NCDs, they all kind of look like this. And what you see here is a heavy emphasis on behavioral factors and blindness when it comes to upstream environmental or planetary factors. So the insights that I just shared regarding the role of planetary change drivers to NCD risk is an important way to enrich the conversation about NCDs. Secondly, the strategies that we need to deploy to tackle NCDs go beyond the behavior change strategies implied by the blinders on the previous slide. I would submit, and this has been a theme throughout this meeting, that the strategies we need to tackle NCDs do include behavior change when it comes to diet and smoking. That's fair enough. But carbon pricing to reduce greenhouse gas emissions, cleaning up our political systems so that they can more responsively address issues of planetary sustainability, building social justice into all of this so that what we do with equity, and supporting and celebrating the activism, a taste of which we got to see yesterday, because that, I think, is one of the most important drivers of achieving planetary sustainability, which will in turn help to reduce the risk of non-communicable diseases. Well, in closing, the standard benediction, the required benediction at the end of every academic talk is more research is needed. I'm not going to say that, but I will use the Plan B required benediction at the end of an academic talk, which is if you'd like to learn more about this topic, you might want to read a paper that Andy Haynes and I read that explores these causal pathways in much more detail. Thanks very much for your attention.
Thank you very much, Howie. That was an excellent talk and a great start. We're going to keep the questions till the end, so I'd like to move right to our next speaker, Modi Maswama, who is also with the Wellcome Trust, Our Planet, Our Health initiative, where she leads research, partnership, and policy work on healthy diets and sustainable food systems. Modi, please welcome.
Good afternoon, everyone. Thank you for the invitation to speak here. I've been really enjoying being at this meeting. So I'm going to be talking about some of the links between food systems, healthy diets, NCDs, and sustainability in the environment. So this first slide shows the global burden of disease by dietary risks from a paper published earlier this year. And basically, it's divided the different causes of death by the major risk factors. You've got the non-communicable diseases kind of in the blue colors, the infectious diseases largely in the orange colors, and then you've got other diseases in the greens. And the biggest dietary risk for deaths, and whether you measure it by deaths or morbidity, are dietary risk factors. And you've also got other diet-related risk factors in there, which also are things like high blood pressure, body mass index, and alcohol use, for instance, from this slide. So the dietary risks include things like insufficient fruit and vegetable consumption, insufficient nuts, too much fat, salt, and sugar, lots of too much processed meat and red meat, for example. So take-home message, diet is the biggest risk factor for non-communicable diseases compared to some of the others. The EAT-Lancet report was published earlier this year, which many of you will be aware of, which sets out this planetary health diet that sets out the limits in terms of what different food groups are needed to be consumed to meet both health and nutrition requirements, but then also to be sustainable and not affect the planetary boundaries. It looked at 6 boundaries, which include climate change in terms of greenhouse gas emissions, biodiversity, land use, water, nitrogen, and phosphorus. And the diet is based on global averages, based on what everyone in the world, on average, needs to be eating. And it does need to be translated, because it's based on global averages, into national country-specific contexts. But it provides, for the first time, a sustainable diet that looks at both the environment and health considerations globally. And the take-home message from what this study found was that at the moment, globally, we're, as a global population, eating too much meat. We need to halve our meat intakes, and we need to double our fruit and vegetable intakes as well. This next slide shows the EAT Planetary reference diet in the context of what people are currently eating in the US. It's very similar to other high meat consuming countries like Europe, the European region, and then also Latin American countries like Brazil. And what it shows, you've got the circle showing the limits for both health and the environment, or for the reference diet. And what it shows is that in general, people in the US and other related countries are eating too many animal source foods, up to 600% more meat and beef than is actually required for what is actually healthy and also sustainable. And they're eating far too few protective foods, such as fruits, vegetables, pulses, nuts, and beans. And so this characterization shows an example of what needs to change in high-consuming countries. In the developing world, it's very different. The animal source foods are not eaten in sufficient amounts, and so a lot of countries need to increase their consumption of those. But then equally, fruit and vegetables, the protective foods, are also equally not being consumed in sufficient amounts. So literally everyone around the world needs to increase their dietary diversity to consume more of those protective foods. This slide kind of shows different types of foods based on their environmental footprint. It looks at 3 particular environmental things: greenhouse gas emissions, water, and land use. And basically it shows that the foods with the highest environmental footprint are the ones to the far end of the graph, which are basically things like beef, dairy, poultry. The animal source foods have the highest footprint in terms of land, water, and greenhouse gas emissions. Those with the smallest environmental footprints are things like fruit and vegetables, and pulses and beans. Also, interestingly, sugar has got a very low environmental footprint. So foods that are high in sugar often tend to be good for the environment, but obviously not good for NCDs. And the food system accounts, as I guess we've heard before, for 30% of global greenhouse gas emissions, 40% of land, and 70% of water. And so it's a very important system to target for net zero strategies. But equally, if we don't address climate change, it's going to also have an impact on the nutrition quality and quantity of foods that we're able to produce in the future. So really important that we address this problem. So what are some of the solutions? I've just highlighted 3 here because I don't have very much time. The first is looking at what the fiscal policies are in the system. Most governments around the world currently provide some form of agriculture subsidies, for example. This slide looks at the US example, and you will see that the majority, 63% of subsidies for food production in this country are for meat and dairy, animal source foods, the very foods that people are eating too much of. Subsidies in the system work in terms of driving consumption. By comparison, less than 1% of subsidies currently go to fruit and vegetables, the very foods which people need to be eating more of to be healthy. This picture is very similar in Europe. It's also very similar in other parts of the world where there's hardly any money going into producing, marketing, promoting fruit and vegetables, the foods that everyone around the world needs to be eating more of. So fiscal policies need to be addressed, reforming agriculture subsidies, but then also things like taxes to think about how we redress some of the externalities associated with these foods. The second solution that's currently being considered is things like environmental impact labels. Some of the researchers we're funding who are also in this room are looking at some of these solutions. And Denmark is an example of a country that's starting to, has committed to introducing environment labels on foods in a similar way that food labels have been introduced. There are some questions that need to be asked. Do they change behavior? Early evidence suggests that yes, they do. But also, as I mentioned before, how do they work alongside nutrition labels? How might it affect people's choice of foods which are high in sugar, which might therefore have a low environmental footprint, but then be really unhealthy on the health side? So there's still questions around that, and also what the impact of these labels might be on the producers and the companies that make these foods. And then the third emerging area of solutions is developing alternatives to meat, because a lot of us are eating too much. So these plant-based products. So we need to shift from meat, and one way we could do it is to get people to eat more beans, pulses, plant-based sources of protein that are minimally processed. Another would be the development of new plant-based protein foods, such as the Impossible Burger. And I've just given 3 examples of those. We've also got a new category of snacks, such as this pea and bean crunchy sticks that are coming on the market, which are a way to get people to eat more pulses, increase their fiber. Again, people aren't eating enough fiber. But there is a difference in the price of these different solutions. So, for instance, if you buy a bag of frozen peas in the UK, last week the price was £1.20 per kilo, whereas the price was over 20 times more expensive for the Impossible Burger. So it's quite an expensive way of promoting a switch to plant-based foods. There's equity considerations in there. But also there's considerations around nutrition content. So as an example, the salt content of these products increases significantly as you go across. There's 0% salt in the peas, 10% of salt in the pea and bean snack product per 100 grams, rising to 17 grams or 17% of salt. This is a percentage of people's recommended daily amount in the Impossible Burger. So it's a good solution from an environment sustainability consideration. It's also a source of salt. It also provides 30% of a person's recommended daily amount of fat. So there's potential trade-offs in these solutions that also need to be considered as they're being developed. I just put up this slide. It's a bit old, but basically it looks at the potential health impact of different types of regulations to tackle obesity. And what it shows is that fiscal measures and regulatory policies like food advertising regulations give the biggest health impact, whether it's measured by disability-adjusted life years or healthy life years, in terms of if you want to improve health. We need to get similar studies in terms of what are the evidence of the most effective, cost-effective interventions to promote sustainable diets and the sustainable food systems agenda. Some of them will be very similar, and there'll be lessons that we can learn from these, which we're already thinking about. And so to just end on the lessons from my experience in this field in general, and the evidence so far is that solving the diet problem will require integrated food system actions that address both health and the environment. The pace and scale of change needed is unprecedented. We need to, for instance, to get to net zero, we're going to need to halve meat intakes by 2050. We've never achieved such a scale of dietary change in that kind of pace and scale of time. We need to get industry on board, governments on board, etc. We also can learn lessons from the area of obesity. We still haven't solved that as a problem, but it certainly provides lots of co-benefits for tackling the environment side of the food system. And yes, as I said before, we need to develop evidence on what the priority diet interventions are, both for the environment as we have them for the NCDs agenda. Thank you.
Thank you, Modi. And so continuing to build on some of these themes, we have Bill Dietz from George Washington University. You met him in the last panel. Bill, thank you very much.
Thanks, Herb. Just to amplify on a few points that Herb made, this is the global syndemic again, which offers what we call double and triple duty solutions, and I'm going to deal with some of those. But I wanted to point out that, following on Herb's comment, that obesity is also a major cause of cardiovascular disease, diabetes, and cancer. So that if we address obesity successfully, then we reduce the major chronic disease categories that Herb mentioned. One of the other points that Modi raised was the importance of nutrition as a global problem. Malnutrition in all its forms is the highest risk for ill health and premature death. The types of malnutrition differ. Malnutrition used to be synonymous with undernutrition, but in fact it represents obesity, undernutrition, and dietary risks. And as you look at this slide at the top, you see that the prevalence of obesity is highest in developed countries, and declines as you go down in terms of income, and undernutrition rises. The contribution of dietary risk, which is micronutrient malnutrition, is variable across these countries. But the important point here is that malnutrition in all its forms exceeds the risk of tobacco, elevated blood pressure, and abnormal glucose tolerance. So it really is the major focus of chronic disease prevention. Now, the double and triple duty solutions are important on the agricultural system, which Modi emphasized that accounts for about 20, and Howard emphasized that it accounts for about 25% of greenhouse gas emissions. And so in the center here, we see beef production, dairy, and ultra-processed foods, and their production contributes both to climate change and to these chronic diseases, obesity and its consequences, diabetes, cardiovascular disease, and also colon cancer. But the solutions to changing these systems are in these drivers that are below. They are cultural norms, the supply and demand. I mean, that's really what sustains the beef industry is the high demand. Or the subsidization of commodity crops that Modi mentioned. The heavy promotion, the slogan for those of you in the United States for Arby's know that we've got the meats, which is a very active promotion of beef consumption. Price supports are sustained by the subsidies. We don't pay the true costs of production. And the cattle industry is a very powerful lobby which blocked the inclusion of sustainable diets as part of the last recommendations for the U.S. Dietary Guidelines Advisory Committee. So these are where we need to focus. And part of the challenge is that the foods that we have ubiquitous in our diet, the ultra-processed foods, which account for about 60% of the calories in the United States, are inexpensive. They last forever. They're very tasty because they're high in sodium, fat, and sugar. And that's and their prices don't really reflect the environmental cost of their production. So what are some of the double and triple duty solutions? Well, one that has been discussed a lot here is the increase in plant-based foods and reductions in beef consumption. So how do we create demand for alternatives when the existing alternatives are so tasty? Could we redirect subsidies to produce healthier products and to supply healthier products for underserved communities where the norm is consumption of ultra-processed foods because of their inexpensiveness, wide availability, and they're tasty. Sustainability food labels could change consumption, but the net effects of these interventions would be to reduce obesity, to increase the available land for agriculture, thereby addressing the food shortages in the developing world, and overall the lower greenhouse gases from agriculture and cattle production. Ultra-processed foods have recently been shown to be a significant contributor to obesity. Their effects on greenhouse gas emissions are considerably lower than other sources of greenhouse gas emissions. But their real consequence in terms of planetary health is environmental degradation. Corn production, which contributes to high fructose corn syrup, which in turn feeds the sugary drinks that are so ubiquitous, is a terribly damaging form of agriculture in terms of its herbicides, its pesticides, its water requirements, and the fertilizer requirements, which are responsible for the dead zone in the Gulf of Mexico that now approximates the size of New Jersey. So how do we begin to reduce that? Well, again, implementing food labels, beginning to change consumer behavior, which in turn, though, requires the political will to change those labels. Again, redirecting subsidies and increasing the availability of unprocessed foods. Now, the agricultural system is rightfully a focus of these activities because it generates about 25% of greenhouse gases. But the other source, important source in the food system is food waste, which accounts for about 8% of greenhouse gas emissions. There are some triple duty actions here. So again, consistent labeling, and one of the most promising is this notion of best if used by to indicate food quality, and used by a date to discard the food because of food safety. And what's interesting about this intervention, which is a purely labeling intervention, is that industry seems pretty responsive to it. That this is something that is not seen as an imposition, but rather a clarification for consumer behavior. Reductions in portion size. I think in restaurants, which are a major source of food consumption in the United States, portion size is enormous and contributes substantially to food waste because the portions can't possibly be consumed. How do we begin to restrict or reduce portion size? How do we begin to change demand for portion size? Well, perhaps an emphasis on the food waste side is likely to be more appealing. The other point to be made is that one of the easy focuses is institutional capacity. Now, composting is a cost. It's a cost for cities, it's a cost for states, it's probably also a cost for companies. So it becomes a relatively easy target to think about how we influence industry and particularly large employers who have a substantial food cost to invest in institutional capacity to reduce waste. Now, there are a lot of promising developments that contribute to the mitigation of climate change. You know about Meatless Monday. What if we change that to meat only on Monday? The production of beef alternatives we've mentioned. What's interesting is that there's a 5% annual growth of sales of sustainably produced products. This is already happening. How do we build on that movement? The growth of better-for-you products exceeds the traditional products that industry has produced substantially. That's where the growth in industry is occurring. How do we implement corporate implementation of sustainable practices? So corporations can affect this, not only corporations and municipalities for that matter, can not only affect their, this whole area of greenhouse gas emissions by incorporating sustainable practices, but they're also big purchases. So their procurement policies could be consistent with what we consider a sustainable diet. And this is already underway in the C40 cities and the American Cities for Climate Challenge, which are focusing on greenhouse gas emissions through food waste. New York City has announced that it's going to procure less meat and eliminate the purchases of processed meats by about 2025. But many of these cities, most of these cities are focused more on greenhouse gas emissions or on transport strategies to reduce greenhouse gas emissions. But these are disconnected. One of the major challenges that we face is that there is no consistent grassroots initiative around a common issue. And so the next steps are really to begin focusing on these double and triple duty actions which affect not only human health, but also environmental health. And to do that, we've got to move from what, which we know, and we've heard a lot about what at this conference, to how do we do it. And I would suggest that this begins with linking networks to focus on collective actions locally. There has been no social movement in the history of this country that has started at the national level. The tobacco has started locally, the civil rights started locally, Mothers Against Drunk Driving started locally and then spread upward. I think if we're going to be effective at reducing climate change, this also has to start locally and focusing on individual behaviors and individual initiatives. But to do that, there needs to be an agreement on what issue to focus collective action. A social movement at the local level also needs to establish communication channels for the rapid diffusion of innovation. So what's happening in one community can be shared with that in another community. And very importantly, we need to identify, implement, and monitor measures to assess progress and accountability. If you can't measure it, you can't do it. We need those measures to hold policymakers accountable. And I've already mentioned the procurement policy. In terms of lobbying, in terms of political action, I think it's important to remember that there are no stories without data and no data without stories. Stories, the narrative, is a terribly compelling factor for policymakers, but if it's buttressed by data, and this is where the science comes in, those points are even stronger. And we're also likely to hear challenges on evidence to act. But I would remind you that we don't have the time to operate or act on the best possible evidence. We need to act on the best available evidence. Thank you.
Thank you very much, Bill. Our final speaker, you also met previously yesterday. It's Dr. Christy Ebi from the University of Washington. Please give her a nice welcome. Thank you.
Well, thank you, everybody. There's just me and one other presentation, and you're done. So I decided I would keep it short, and I don't have any slides, something you don't typically do. You just heard three just amazing, powerful, content-rich presentations on the two-way connections between greenhouse gas emissions, the sources of those emissions, and what that means for NCDs. And I'd like to take a different perspective. 80% of all our greenhouse gas emissions come from just 20 countries. So I'm here representing the rest of the world. Their main focus has to be on adaptation. It's one of the two main policies for climate change. They are suffering now from the impacts of a changing climate. They are implementing actions to do various activities, early warning systems, trying to improve infrastructure. And there's lots of opportunities within those adaptation options that are being evaluated to address the challenges we have with NCDs. And hopefully this will inspire a few people to think about some opportunities in the kinds of projects that you're involved in. I'm going to step back for a minute and talk about how we frame the challenges of a changing climate for health, for other sectors as well. We're looking into the future. The future is uncertain. So we're looking at risk. Risk is probability times consequence. We don't have a lot of certainty about the future. We like to think we do, but we have less certainty about the future than we would like to imagine. And when we frame risk, we're looking at the intersection of three basic factors. One are the hazards created by a changing climate. The second are the human and natural systems that are exposed to those hazards. And the third is the underlying vulnerability, where vulnerability can be framed in terms of both the sensitivity of systems and the capacity to be able to manage. So when we look at adaptation, we're not just looking at managing the hazards. We're looking at what needs to be done in all three factors, looking in terms of what we can do to change exposure and looking in terms of what we can do to reduce vulnerability, increase resilience. From the international community, when we look at adaptation, we look at the short-term, urgent, and immediate needs, and we also look at the longer-term needs. And there are lots of opportunities here to try and address challenges with NCDs. So a couple of examples. One is that when you look in the Pacific, about 90% of the population is overweight and or obese and or hypertensive. This makes them both much more vulnerable to extreme events. The Pacific Islands have been hit frequently by typhoons, and this makes their population much more vulnerable. They don't have disaster risk management systems that really take into account the health status of their populations. They don't provide advisories, for example, that when people have to relocate, they take their medications with them. It's critically important that that be done, and there's efforts underway to try and make sure that happens. But you can also think about how you can use adaptation to move forward on other aspects of NCDs. There are early warning systems in the Pacific, for example. There's also early warning systems throughout Asia and Africa that focus on agriculture. And so the farmers will get messages that there's the right environmental conditions and there's a risk that their particular crop will fail. But those aren't connected to health messages. If you're in the Pacific and you are going to see a failure of the taro crop, what do you eat instead? People are not provided with that messaging. We're missing opportunities to ensure that we have transitions to sustainable and healthy diets. The task ahead of us is quite large when we look at reducing vulnerability overall to climate change. Specifically for heat, there's one estimate saying if we want to keep heat-related mortality the same, which is unacceptable, but if we wanted to keep it the same, that we'd have to reduce the vulnerability of adults over the age of 65 by 75% towards the end of the century. We don't have a lot of options at this moment, but we do need to think about how NCDs interacts with heat and what can be done to make sure that we have populations that are much more resilient. Going forward, there's a couple of issues I wanted to mention. One is awareness, making sure that people are aware of the opportunities of using adaptation to help address NCDs. We need innovation. I mentioned a couple of examples where not much work is being done. There's opportunities for the students in the room. And the third is investment, that the overall investment in health adaptation is only 1% of the international investments in adaptation, and most of that are for projects that are starting this year. So we need a lot more investment to make sure that we can have our populations much more resilient and much healthier going into the future. Thank you.
Well, I'd like to thank all of the panelists for their extreme discipline and sticking to time, and thanks to that, we have time for some questions. So I have seen that this is a fairly inquisitive and lively group, so please come with any questions and we'll get you a microphone.
Thanks. Jenny Lane from UC Davis and the vet school there. I just have one comment and one question. And my comment is that there's no dispute that most of us in this very privileged country and other high-income countries need to eat less animal source foods and less beef. But I'd like you to maybe make a comment on the fact that not all livestock production systems are the same, just like we heard with fisheries, and that in some well-managed grassland systems, beef actually play a really critical role in maintaining those ecosystems, since we've lost all of our other megafauna that those grasslands evolved with. And then I think you also said that, maybe I misunderstood, that we need to make more land available for sustainable agriculture. So are you actually suggesting that we take more land to grow food, or that we just convert existing farmland? Thank you.
Who wants to start on that?
I think that was my comment. I think we have to be clear that you're right, that beef consumption can't be completely eliminated. There's a whole economy dependent on it in the United States, and beef is a great source of iron and vitamin B12 and other nutrients. But we need to reduce it. And I think that when I said that if we reduce beef consumption, we free land for other plant-based foods, which we're currently importing. So I think, yes, that so much land is devoted not just to beef production, but also the forage in terms of commodity crops to feed the beef. So I think that's a big reversal in terms of land use, water use, and methane production.
Anybody else want to come in on that?
Agree.
Okay, good, agreed. Next question. Yes, Michelle.
First of all, thank you for this panel. This is a question to Dr. Dietz and also to Dr. Frumkin. I loved your statement that there is no good data without good stories and no stories without data. But I have many students that want to do deep dives into data around climate and planetary health, and very few people, Dr. Frumkin being the exception. What advice do you give many of the students in the audience as to how to do good science now during this administration?
You want to start?
Sure.
Thanks, Michelle. Unpacking your question, there are some interesting elements to it. There's the question of the balance of data and narrative. There's the question of doing good science, and there's the question of the shadow of the administration looming over everything. I guess a couple of pieces of advice I'd offer students. Even the most data-oriented quantitative student needs to understand that the science doesn't do much good or have much impact without conveying it to those who need to hear it. So learn logistic regression, learn AI, learn all the quantitative techniques you can, but your education's not complete if you don't learn how to tell your stories to those who need to hear them. So I think nobody has any business getting an advanced scientific degree without including as part of that training effective communications. If you can't explain to your mother or your grandmother what you're doing, then you're not clear enough about what you're doing. And then under this administration, I think probably the most important thing, speaking to the Americans in the audience, the most important thing that you can do to advance science is vote in the next election.
I have little to add to that comment, but I think it's important to recognize that just because we have the wrong government at the national level doesn't mean we can't succeed locally, and that's always been the case. So I think it's easy for us all to get discouraged. And I live in D.C. and I'm subject to the intense news that pours out of every pore in that city, but we have to remember that most of the progress is not going to occur in D.C. for the next 2 years, and hopefully that's only 2 years, but it's going to occur locally. So I would encourage your students not to give up and to keep their heads down and focus on the work that they're doing and learn how to talk.
If I could add to that as well, when you look at the budgets within the U.S. for the federal agencies, they haven't really changed. Science is still being funded. The pronouncements that come out of the White House is different than what Congress chooses to do, and it's Congress's job to look at the budget. And so most of the agencies have seen their budgets stay about the same or increase slightly. There is funding for research. You may need to do a bit of reframing in what you call things. That's happened across all of the agencies since before the administration took office. It happened the day after the election that various agencies started renaming laboratories, renaming departments. But the funding is there, and it's how you think about framing it and making sure that you understand the bigger picture of what it is you're trying to address and look at the pieces that you can move forward with today, and you'll be successful.
I have one other comment. The dietary guidelines for Americans are legislated to be done every 5 years. This year, I think I mentioned in my comments that the meat industry shut down the sustainability suggestions that were emphasized in the 2015 guidelines. those are off the table for the 2020 guidelines. And one of the things that all of us can do is put pressure on the USDA to allow sustainability as part of the dietary guidelines.
Yeah, I'd absolutely support that. A similar process thing happened in Australia as well. So, keep on top of these kind of developments. I'd advise students. But then also, in terms of the stories, get some practical experience on the ground. Go and spend time in NGOs who are working on these issues. They're very good at storytelling and actually, translating the data that you guys are producing into action. So that's the other bit of advice I'd give.
Thank you very much. Any other questions? There's one in the back there?
Yeah, hi there. Chetan Sarabhoma, a pediatrician here at Stanford. Speaking of financing and health, one of the big opportunities that we have right now is, ever since the Affordable Care Act was passed, at least in the United States, where we spend the largest portion of our money in healthcare, we've, for the long time, paid for more healthcare when people get sick. But with the Affordable Care Act, there's been this movement towards actually putting money towards prevention with accountable care organizations and a whole complex series of changes. But there is the political moment in healthcare funding to shift money away from spending more on disease and to shift it more upstream to prevention. But the thing I haven't seen is the linkage between what's going on in the healthcare economics conversation and what's going on here with the planetary health movement. So I was wondering if anyone had anything to kind of say at that intersection. How can planetary health be part of the conversation in remaking the economics of our, at least US healthcare system?
Howard?
It's a great question, and it's part of our difficulty is that if we talk about our challenge in terms of health economics, then we're thinking about the flow of dollars within the health system. But I think one of the core messages of planetary health is that a lot of the preventive efforts that you so rightly talked about don't happen in the healthcare system at all. They happen in agriculture or in urban planning or in transportation and planning or energy policy. So I think one of the ways to make that linkage that you're calling for, again, I would agree with you, is the health in all policies approach. That is, we in the health world who care about advancing health need to move upstream, be fluent in the language of other sectors, work with colleagues in other sectors to try to get implemented the most health protective policies we can. But I'd even go one step further. I don't personally like the term health in all policies because what it connotes is us in health begging other people to do our thing, to please advance our agenda. Well, that's fine. But I have found over the years that what's much more effective is when I go to a transportation engineer or a city planner and I say, how can I help you be successful? It changes the debate and it focuses us on shared goals across the sectors so that we can advance in tandem goals for mobility or for food production or for energy generation together with health. And it's that composite thinking that will really move us forward.
I'd agree with that, and I'd also say that one of the things that's impressed me the most during this conference are the number of people who are trying to quantify the costs of either action or inaction. And we saw that even in the last panel, and that's incredibly important to be able to reach certain types of stakeholders who are financially driven. So I would encourage everybody to keep going down that path because sometimes a big dollar figure is what's going to motivate a policymaker or a politician to act.
Could I respond to that too? So one of the things that I'm sure you've struggled with as a clinician is how to engage families around obesity prevention. It's a struggle, I know, because I've done that. But one of the alternatives would be to see whether they would engage around planetary health promotion by changing their diet. And that would be a stealth intervention aimed at obesity.
I think we have time for one more question. Yes, in the front here.
Hello, thanks for a great panel. My name is Rita. I'm a primary care doctor and a researcher looking predominantly at non-communicable diseases and humanitarian crises. And as we know, it's an increasing burden in that community, but we also know that humanitarian crises are being driven by climate change, and it's something that we're going to be seeing more of. And so I go to humanitarian congresses and humanitarian conferences, and we talk about non-communicable diseases. And here we're talking about non-communicable diseases, but how can we start having the conversation between the planetary health community and the humanitarian community about what needs to be done? And maybe some advice as an early years researcher, how can I start combining all of those points together? Thanks.
Well, I think you could explore the global syndemic. One of the areas that we could not address in our report just because we didn't have the time or the resources to do it is modeling the food system in a way that begins to point to intervention targets. I gave you a few, but those are really just top of mind. And I think there's much more work to be done to underpin or identify new areas. As Dr. Banerjee would say, this would be system acupuncture. And that's what we need. We need these double and triple duty solutions, some of which are not practical given the fact that they're regulatory and depend on governance, but some of which may well work that we just have not discovered.
It's a very good question. In many ways, that process is underway. Professor Chris Field, who's sitting a couple rows behind you, led the Intergovernmental Panel on Climate Change special report on managing the extreme events and disasters to advance climate change adaptation. Do you think somebody negotiated that title? And it was the first time that people from the climate change community, specifically the adaptation community, worked side by side on assessment with people from disaster risk management. And that has had ripple effects. The report came out in 2012. If you look at the Sendai framework, health is central to that, adaptation is central to that, climate change is central to that. So we're starting to see, certainly at the international level, the integration of these issues. Countries understand that they can't look at climate change separate from disaster risk management. And so at the country level, you see teams that are working very closely together on these issues, including often the Ministry of Health. So advances are being made. There's organizations like the International Federation of the Red Cross, Red Crescent Societies, who's been working very actively in this space. Joy's working at the World Meteorological Organization, and there's a lot that's going on at WMO about both issues. And so you're starting to see real shifts at the international level, and you're starting to see in some countries shift at the national level, and even in some places at the local level. So I think you have a lot of opportunities going forward, and thank you for working in that space.
Howie will give you the last word.
Okay, yeah, again, thanks for that question. Just one more comment. The planetary changes and non-communicable diseases intersect exactly in the humanitarian space in terms of the interruption of medical care for people with chronic diseases in the context of disasters. So upstream solutions here in this country would include simple interventions like universal health care and universal electronic medical records. Strengthening health care so that it's more portable and can survive disruptions would be a good idea. Internationally, the same thing, universal health coverage, strengthening health systems so that people who need to relocate in the wake of a disaster can continue to get care would be a good set of defenses against the interruption of care.
Good. Thank you very much. As an adopted Swiss, I need to call time. Please join me in thanking our panel for doing an excellent job.